We will now demonstrate the procedure for a blood draw from the PICC line, port, or tunnel catheter. In this case, we will be using the tunnel catheter. The procedure has been explained to the patient, and the nurses washed her hands and dried them with a paper towel. Supplies have been assembled on a clean surface. For a PICC line, a new positive pressure cap and extension is assembled, and a 10 ml saline flush is used to prime the cap, inverted, tapping to loosen air bubbles. For a tunnel catheter or implanted port, we will only be using a new positive pressure cap, set aside for later use. If drawing from a line where medication or solution has been infusing, stop the infusion for at least 5 minutes prior to the blood draw. The catheter cap is cleansed with alcohol and flushed with 10 ml of saline using the push-pause method. The nurse will now apply gloves. And the tape is removed from the junction of the cap and the catheter. The junction is cleansed with 3 alcohol swabs, wiping for 1 full minute. And the cap is removed. An empty 10 cc syringe is attached directly onto the catheter. Withdraw 5 milliliters of blood and discard, unless otherwise instructed. Attach another empty 10 milliliter syringe and withdraw the appropriate amount of blood for the tests ordered. Set aside. If necessary, cleanse the threads of the catheter with alcohol to remove any blood from the threads. Attach a 10 ml saline flush to the catheter hub and insert the contents using a push-pause motion, stopping at the last 1/2 milliliter. Attach the new primed positive pressure cap, or the cap and extension if it's a PICC line. Insert the contents of the second 10 milliliter saline flush in the same manner. This will be followed with a heparin flush if the catheter is open-ended. At this time, the blood will be transferred from the 10 milliliter syringe to the lab tubes using the blood transfer device. Remove gloves and tape all connections between the catheter and the cap. Document procedure in the progress note, including the amount of blood withdrawn for waste and for the lab tests, the tests that were ordered, as well as the amount of flush solution administered. If the catheter is valved, there is no need to clamp during the lab draw procedure. If the catheter is open-ended, requiring heparin, the catheter should be clamped when removing the extension and changing syringes for the draw.